Okay, great, everyone. My name is Siddharth Damber, physician here at Chicago Arthritis and Regenerative Medicine. Welcome to today's webinar, which is titled The Truth About Regenerative Medicine. Thank you, everyone, for joining today. So what you will get from this webinar is the following. You'll definitely learn more about the best available treatments for arthritis, tendinitis that do not require surgery. That includes a lot of the regenerative medicine treatments. You'll learn what is legitimate and what is not legit in the field of regenerative medicine, how to choose the best physicians and clinics for regenerative medicine, really how to avoid less qualified options. And if you can stick around for the length of this, you'll also get a discounted offer at the end of the webinar. My plan is to essentially, I've got plenty of material to talk about and, about 30, 35 minutes worth of material. And actually, I'm getting a message that maybe audio, some folks are having a little bit of difficulty with the audio. If that is the case, can somebody else please let me know if they can hear me loud and clear? Okay, perfect. Good. Yeah, excellent. So good audio, no video. Are you guys able to see the actual slides? There we go. Okay, hear you fine. Lost your camera. I could hear you perfectly. All right, perfect. All right. Well, you guys should be able to see the video now. And if not, let me know, but I'll get started. All right, great. So, as I'm speaking, by all means, we'll have time at the end to answer questions, but I can certainly take questions, in the flow as well. And so if you have questions, feel free to ask them. The nature of the chat feature is that, it may take a minute or two for me to catch up to it, but, I will certainly try to answer as I'm going along. All right, so, the really big question is, when it comes to your musculoskeletal health, what would you do if your pain was controlled? How would your life improve? What exercises would you restart? And what activities with family and friends would you participate in? End of the day, we can help a lot with pain relief and functional improvement. And that is definitely the goal of regenerative medicine and non-surgical treatment options. So who am I? My name is Siddharth Damber, physician at Chicago Arthritis and Regenerative Medicine, initially specialist in rheumatology, also specialist in image-guided musculoskeletal injections. I've been in practice since 2008, practicing regenerative medicine since 2008, and in the Regenix Network, which is the largest network of physicians in practicing regenerative medicine since 2012. So my journey into regenerative medicine. So, when I started in practice in 2008, there really was very little in the way of regenerative medicine. That was very, very new. And I originally got interested because of my own shoulder. So with my own shoulder, I had played competitive tennis when I was a teenager and then stopped playing for some time until my mid-30s. And when I was toward the end of my own fellowship training, I had started to get involved in diagnostic musculoskeletal ultrasound. And the interesting thing with that modality is that you start to look at tendons and ligaments in a very different manner. And what's cool about that is you start to realize just the level of subtlety and details involved in those kind of tissues in a way that you really don't learn in any other way. And it made me realize that whether it's my own shoulder or for patients, that there need to be better options for treating those kinds of musculoskeletal injuries than what we typically have. So the traditional care for musculoskeletal conditions, and this is whether you're talking about tendinitis and tendon tears, sprains and strains, arthritis, joint pains, back and neck pains, is you're basically masking the pain and you're basically waiting for eventual surgery. The traditional care for these kind of conditions is not very good. It's really just waiting for a disaster. And that means there's a lot that could be better. The problems with traditional care are, number one, pain medications don't fix the problem. They're really just masking the problem. Number two, there are a lot of side effects with traditional care, including potential damage to the kidney, stomach, liver, and even heart and bleeding. It's a recent study that came out showing that patients with arthritis who are reliant on anti-inflammatory medications like Advil, ibuprofen, have a 40% higher risk of heart disease compared to the general population. That's stunning. That's actually data that came from a very large database in Canada. The traditional injections that are utilized for wear and tear arthritis and tendinitis, back pain and injuries are either steroid injections, which can give pain relief temporarily, but long-term can damage tissue, can increase the risk of infection, can also lead to diabetes and osteoporosis if given too often. The other kind of traditional injections utilized by pain management include nerve blocks and radiofrequency ablation. Problems with those include potential for nerve damage and even muscle weakness. Surgery has a role in some cases, but the reality is that it has issues as well, including a higher risk for infections such as bleeding, infection, tissue damage, anesthesia risk, and cardiac risk. Certain types of surgeries, like clean-out surgeries, will actually leave the joint more unstable and can actually accelerate the arthritis process. Many routine surgeries that have been used traditionally, including knee arthroscopy for, again, clean-out surgeries, have been shown to be no more effective than physical therapy and are progressively losing favor amongst newer orthopedic surgeons. For those of us that are relatively deep into regenerative medicine, there's a sense that eventually 80% of musculoskeletal conditions that are going to surgery we will be actually able to avoid them. In much the same way that much of cardiac surgery, which used to be done with big open heart procedures, is now done via needle-based procedures. So really, we're searching for better options. Certainly, I've been searching for better options, and those options would include avoiding side effects that have and that are lower risk, and actually improving the cause of the problem, as opposed to masking the problem, and looking for longer-term improvement. So imagine being able to reduce your pain and getting back to the activities you care about without surgery or pain medications. So, the approach that we have here at Chicago Arthritis and Regenerative Medicine is as follows. First and foremost, we're focused on non-surgical options. Treatments for your arthritis, tendinitis, injuries, and back pain. We're not looking to eventually get to surgery. We're looking to avoid that. Part of that evaluation process is to look at inflammation, instability, asymmetry, neuromuscular issues, all the things that really drive pain. And then to try to correct those with low-risk interventions. To begin with, just basic things like exercise and supplements. That's not working, then escalating to possibly a regenerative medicine treatment. And in that case, utilizing the highest quality products from your own body with a plan that is specifically tailored for your condition and needs, and eventually also delivering your own cells using the highest level of image guidance. And I'll go through each one of those in a moment. So regenerative medicine, this is essentially a field and process where we're using your body's own cells to treat the arthritis, tendinitis, injuries, and back pain. We're utilizing the body's normal healing process. The normal healing process, for example, if you have a cut, you have an influx of platelets and other growth factors. Those platelets and growth factors create a clot and inflammation, and there's then a progressive cellular healing repair process. Tissues with poor blood flow do not heal well. That includes tendons, cartilage, ligaments, discs, labrum, and meniscus. Regenerative medicine is essentially the process of injecting your own cells to coordinate the normal healing process into tissue that has been damaged in order to recover. actually a question regarding bone-on-bone arthritis. We will talk about that in a moment, actually. So why regenerative medicine? Number one, it treats the source of the problem, meaning the source of the problem in a degenerative arthritic joint or tendon is really instability, some chronic inflammation, neuromuscular issues. We can treat all those kind of things. Now, so treating the source of the problem is key. These treatments are much safer than surgery. They're effective for most musculoskeletal conditions. And, for those of us that are pretty hardcore into regenerative medicine, we really feel confident that eventually 80% of traditional orthopedic surgery will eventually be managed by regenerative medicine. So how does regenerative medicine work? In a number of different ways. Number one, if you take a look at a joint or a tendon that's been injured, what you'll find are cells that are no longer functioning well. Arthritis and tendinitis is really a biologic problem primarily, as opposed to a structural problem. So these treatments are able to help assist damaged cells in a joint or tendon to work better. Those previously damaged cells have a poor production of the right kind of proteins and enzymes that keep that joint and tendon healthy. Adding your own cells, whether it's your own stem cells or platelets, helps that tissue to start working in a more appropriate fashion, and also helps the local stem cells to start functioning better as well. In addition, the supportive structures around that joint, we're able to help strengthen them. That's the concept of prolotherapy. We're able to strengthen the supporting ligaments, tendons, and other soft tissue structures. Anything that adds more stability will eventually help with pain and function as well. Chronic inflammation, even in a osteoarthritic joint or chronic tendon kind of wear and tear, there is some degree of inflammation. We're able to help reduce that as well. And then lastly, your neuromuscular health, meaning how well the nerves are functioning. If those happen to be irritated, we are actually able to help treat those as well, which can actually help not only the nerve that's injured, but all the other muscles, tendons, joints that are also supplied by that. Again, as I'm kind of going through this, as you have questions, feel free to send them via the chat message, and I'll get to them. And we'll keep on moving ahead. So my journey in regenerative medicine. So I started practice in 2008. At that time, if you knew 5 to 10 people, 5 to 10 physicians who were practicing this kind of medicine, you knew almost everyone that was doing this. And so at that point, I was involved in platelet-rich plasma and prolotherapy for arthritis and tendinitis. Progressively, as there was more information, more data, more personal experience, started utilizing bone marrow aspirate concentrate-derived stem cells for more significant arthritis and tendinitis. In 2012, I was invited into the Regenetics Network, again, the largest network of physicians who work in regenerative medicine. Progressively over time, also gotten experience utilizing things such as amniotic cells for tendon and soft tissue injuries, and even utilizing adipose and fat cells for tendon and joint treatments as well. And I'll talk about all that in a moment. So some real basics about regenerative medicine. Great first line question, is this legal? And really the answer is yes, absolutely. There are some very strict guidelines from the FDA. And essentially, if you're using your own cells and you're doing it in a way where you're not manipulating the cells significantly and you're injecting it into damaged orthopedic tissue, that is legally compliant. The FDA has concerns about some of the things that don't have a lot of evidence or data. They also have concerns if something tends to be kind of far out from what's really being done by the majority of physicians. But when it comes to orthopedic care, there's now evidence that goes back to the mid-90s of utilizing your own cells. And so, yes, what we are doing is legally compliant with the FDA guidelines. Question 2, if you are older, if I'm older, shouldn't I use someone else's cells? That's a really common thing that some physicians will tell their patients. And it makes sense in theory, but the reality is that is not correct. For most orthopedic conditions, there is good evidence that using your own living cells is effective. There are potential risks to using someone else's cells, namely rejection, infection, and unknown other possible risks. The vast majority of literature and medical experience in orthopedics with these kind of treatments is with your own cells. Note that in the United States, it is illegal to inject someone else's living cells into yourself, with the exception of certain childhood leukemias. That is a very real concern that the FDA has, and Utilizing your own cells is the right way to go. And the next is there an age limit? And the answer is no. The results for knees, lower back, shoulders, elbows, ankles, and neck are not impacted by age. On the other hand, hip outcomes can be worse with age. What we know is that different joints and tendons and areas respond differently to these treatments. We know that because as we collect more and more data, certainly within the Regenix network, we're starting to see what makes people good and challenging candidates and what areas are easier to treat. So when it comes to hips, the outcomes with hips are more challenging. Someone who has more advanced arthritis of the hips, it has a much lower chance of getting a good result than somebody that has more advanced knee arthritis. Advanced knee arthritis still responds quite well to treatment. What sort of doctor does these treatments? By the way, I see the questions. I will get to those very soon. What sort of doctor does these treatments? So really, it should be a physician focused on musculoskeletal conditions. That may sound obvious, but the reality is there's plenty of physicians who really don't know how to examine a knee from an elbow from something else because they have a focus on some other part of the body. And that's really not who you want to be treating your musculoskeletal condition. In the same way, you wouldn't go see an orthopedic surgeon for your heart. It's the flip. You want to see someone who's got experience with musculoskeletal conditions. You certainly want to see physicians who are focused on non-surgical treatments for orthopedic conditions. If you come at this from a surgical lens, you'll see it from that lens, and that's not what this is about. And then certainly a proper regenerative medicine expert, and I'm going to go through what some of that means. Can these treatments help if I've already had surgery? And the simple answer is yes. There is data from Europe, from Philip Hernigue, in knee and shoulders, that these treatments can certainly help to actually augment what the results are from surgery. In this country, you don't hear a lot about that, but certainly some of the more busy orthopedic surgeons that work with professional athletes do combine bone marrow aspirate concentrate in their surgeries as well for their athletes when they're out of season. Note that if you've already had a joint replaced, you wouldn't inject cells into that. At that point, you have a metal prosthesis, and that's really not something that's going to be treated with this. The exception to that would be, as an example, I have a patient that had a hip replacement and he was still having hip pain, and it turned out his pain was coming from his SI joint. So we treated his SI joint and his hip pain got better. General rules for orthopedic surgeries that I have for my patients: try to keep your own anatomy as much as possible, avoid surgeries that cut out tissue if possible, always consider regenerative medicine treatment prior to going for a big surgery if possible. Always try to get something that's more conservative. Okay, great. Yeah, let me catch up on some of these questions. First question that I see is someone who had x-rays of their shoulders and their knees and evidence that they had bone-on-bone arthritis and that replacement had been recommended. I think the way you want to think about this, if you have more advanced arthritis, is that while you're, number one, is there evidence that you can get better? For shoulders and knees, there definitely is. Number two is always be relatively conservative in your expectations. So for someone who has knee arthritis, while we know that the average improvement is 65 to 70% improvement in pain, if you have more advanced arthritis, it may be useful to temper the expectations a little bit. Can you get to 60% better, 55% better, right? And try to do better than that. So just because it's described as bone-on-bone arthritis, number one, if you have range of motion, then you really don't have bone-on-bone. Number two, we know that arthritic conditions are certainly biologic in nature and that they can still respond. Next question is about hip pain. It really depends on how bad the hip is. If it's advanced arthritis, again, that is a more challenging case. May respond, but in general, hips that are more advanced tend to be harder to get a good result in comparison to knees that can be more advanced. Great question about if you have inflammation in the body, let's say vasculitis or rheumatoid arthritis. My recommendation is always make sure the inflammation is under control first. If that inflammation is under control and what you're left with is some wear and tear, pain in a joint or a tendon, then yes, absolutely, you're still a proper candidate, assuming you have nothing else that's currently active. If the inflammation is currently active, I'd always recommend getting that treated first, because a lot of times some of the pain can get just better by treating that. Next question, do you get your stem cells from bone marrow? Yes, I'll actually get into that a little bit more later on. Another question about tendinosis of the rotator cuff. Absolutely, we treat that kind of day in, day out. I'll actually show some examples of that. Somebody asked about a total ankle replacement. Ankles, it's interesting. I tend to find ankles that when we see them, they tend to be really advanced for some reason. And I'm always surprised, but you can still get good degree of pain relief. Range of motion may be hard if that's already gone, but pain relief is still very possible. I'll get to some of these other questions in a moment. A lot of questions coming in, but I think one way that I think it's good to understand regenerative medicine is what makes a regenerative medicine specialist. I'm going to touch on a couple of these and then also show some examples of patients of how this applies to that. We'll talk about stability. We'll talk about the kind of cells that we inject, and we'll talk about the image guidance to these things. So stability, also known as prolotherapy, is a really old concept actually in musculoskeletal medicine. Prolotherapy, which I'll talk about in a moment, has been utilized for decades and is starting to get more and more popularity at this time. Tensegrity is an architectural concept. It means that under compression, whole structure is stronger than the individual units. We see that all the time in buildings, skyscrapers, bridges. There's a version of that in the body as well called biotensegrity. And an example of that would be someone that has a rotator cuff tendinitis. It's not just a tendon that's problematic, it's the ligaments, maybe a little bit at the joint, maybe a little bit of a nerve as well. And that entire structure offers a lot of support. And so the key to treating someone who has a musculoskeletal issue is you want to treat all of those structures that are actually driving that kind of problem. So prolotherapy is this concept that if you inject certain solutions into the soft tissue structures, ligaments, tendons, and muscles, you can strengthen and support a area that's been injured. You get an initial inflammation, you get a lot of cells that come in, and eventually you get remodeling of the tissue to create something that's stronger. That process can take 6 to 12 months. You can use various different types of cells to actually get that. So what I like about this is, number one, prolotherapy is a really, it can sound simple, but it's a pretty profound concept that if you treat all those layers and depth of tissue that are damaged and injured in a joint or around the joint or a tendon, you can really help to strengthen and support that longer term. So if you have knee arthritis, it's not just a matter of treating the knee cartilage or bone, it's treating the meniscus, the ligaments, the collateral ligaments, the coronary ligaments, the muscles, the tendons, and sometimes even the nerves. That makes a big difference. That leads to progressive strengthening over time, which gives prolonged pain relief over time as well. So a kind of really simple, not simple, but a interesting example of that is a patient who I've seen in the past who had significant lower back pain. This is really not a atypical case, someone who'd had lumbar surgery in the past. We ended up treating with his own platelets originally, the various ligaments of the lower back, facet joints that were arthritic, the muscles that were atrophied, and even the epidural space where the nerves were injured. And originally with just platelet treatments, he had about a 30% response. We then end up escalating to his own bone marrow-derived stem cells, and he's really had a pretty durable response over the last 3 years, and is currently 75% improved. That works because we treat all the structures and issues that are actually driving pain. As opposed to being pinpoint about what we're treating, we're really treating the whole unit. So, right. So a regenerative medicine specialist, how do you know you're dealing with a legitimate regenerative medicine specialist? There's a couple things that I think make somebody the real deal from this prolotherapy concept. Number one, an understanding that there's a slow and steady progress to this. Number two, understanding these concepts of stability and prolotherapy. That's not something that a lot of my colleagues understand. It took me some time to learn that as well when I first got involved in this. Understanding that you need to treat all of those areas that are pain generators and contributing to the pathology. Multiple treatments can be required, and really never offering treatments that damage tissue. Someone who's maybe not as legitimate, they're focused on more short-term progress. They may be treating only one area rather than all the areas that need to be treated. And they're frequently using other treatments that will actually either be harmful to that joint or tendon long-term, such as steroids, or they're actually doing things like burning the nerve to give short-term pain relief that really does not help you long-term. Next concept to understand is the concept of orthobiologics. That's a really kind of busy word that basically means utilizing your own cells and tissues to inject that into damaged orthopedic tissue. This utilizes that normal healing process. You can use either your own cells or someone else's cells. Legally in the United States, it's utilizing your own cells. And I would strongly recommend that because that is where the vast majority of evidence is for these kind of treatments. So I'm going to talk about a couple different types of these treatments. Number one is your own platelets. So platelet-rich plasma. So after an injury, platelets they get rushed into an area that's been damaged. They recruit other cells and growth factors to assist in repair. This uses focused inflammation to help repair tissue damage. These growth factors in the platelets help to also stimulate your own local stem cells to get that effect. So there's a couple different types of platelet products you can use actually. So the way that we prep your platelets is we do a blood draw, we concentrate that via centrifuge, and then we re-inject that into the tissue. So there's a picture up here. You can see either one that is more yellow colored and one that's more red colored. There's a big difference here, even though these are both platelet-rich plasma. The one that's red has a lot of red blood cells. While that can help with muscle-related issues, it's actually not good for tendon and joint-related issues. This yellow colored one, you've taken out the red blood cells and you're just injecting the high concentration of platelets. That is much healthier for the joint and the tendon. So that's important because if you can get a higher and better concentration of platelets, that's better for the joints and tendons. And that takes more expertise and more personalization to your treatment than is typically done if you have a one-size-fits-all approach, which frankly is how most of medicine approaches this, a one-size-fits-all approach, which is not what's in your best interest. So platelet-rich plasma has a high concentration of platelets, good for joints, tendons, and ligaments. It is a bit more inflammatory. Platelet lysate, which is just taking the growth factors from the platelets and injecting that, is good for nerves, and it's less inflammatory. So this is a case study of a 45-year-old man. He's a cyclist. Came to see me. He was referred by a sports medicine physician because he had a lot of persistent knee pain from patellar tendinitis and was continuing to have pain despite conservative management. On the screen, on the right side, this is a patellar tendon. This is a kneecap, the patella. These are little bone spurs in the tendon itself. And we can treat that. We utilize platelet-rich plasma. He had two different treatments. The picture on the right, this is the tendon again, and this is the needle inside the tendon as we're injecting platelets in there. He's 3 years out. I'm sorry. After treatment, he did very well and was able to return to a high level of cycling and had significant amount of pain relief as expected. I saw him a few years later, at which time he'd now had a right knee hamstring strain, and again treated with platelet-rich plasma, and he's again back to his high level of physical activity. What's nice about this example is taking a treatment that is still relatively mild, like platelet-rich plasma, and being able to significantly treat a condition that can be so functionally limiting in this man's case. So keys here, right, for a regenerative medicine specialist and what you should be looking for, understands the difference between these treatments, right? When do you use platelet-rich plasma? When do you use platelet lysate? Someone who has an understanding that personalizing your treatment is important so that you can change what's the level of concentration of these kind of treatments that you use. That's not typically done, but it's something that should be part of the process if you want a better result. Someone who's maybe not quite as up to date would be someone who's using really the same kind of product for everyone that comes in. And realistically, if you're a 65-year-old man who's got knee arthritis, you're a different biologic organism than, let's say, a 25-year-old, more physically active basketball player that has a rotator cuff injury. You need to treat those slightly differently. One person will respond better to one kind of treatment, someone else will respond better to another type of treatment. Not knowing when to use a type of PRP that has a lot of blood in it versus no blood in it, that's a big hint that maybe someone doesn't quite have the expertise here. And not having the flexibility and personalizing your regimen is a problem. The next type of cells that we use in regenerative medicine are your own stem cells. These are really the main cells that drive tissue repair and recovery after an injury. They're really the master cell when it comes to a reparative process. Now, you can get these cells from other people. Understand that it is safer to utilize your own cells, and it's really only legally allowed to utilize your own cells in this country, living cells. So the best studied and most available stem cell treatment in the United States is from your own bone marrow. That comes from the back of the hip bone. That is legal and FDA compliant in the US. I can imagine people are sitting here hearing that and saying, wow, that sounds painful. The reality is that if our patients tell us that discomfort associated with the bone marrow when we do this for their orthopedic conditions is roughly a 3 out of 10. And that's partially because we use a lot of numbing medication, partly because we know how to keep people comfortable. Fat stem cells, you may hear a lot about this. Understand that this is currently not legal in the United States. And the reason why is because in order to get a high concentration of stem cells from your own fat, you have to use an enzyme called collagenase, which the FDA feels is not safe in human use. You can use fat or adipose for structural support without using that enzyme, but that is strictly speaking not a stem cell treatment. You may also hear about amniotic and umbilical cord cells. It's not mentioned often, but these do not have live cells. A lot of times, physicians may tell their patients that this is a better product than utilizing your own cells. That is not accurate. In order for these cells to be sold in the United States, they have to go through the following process. They are collected after birth. They're then freeze-dried. They're then gamma irradiated, basically pulverized, fried. And then they're basically crushed into a powdered form. They're then put into glass vials, shipped to the physician's office, where they can sit for anywhere from up to 18 to 24 months. And before being used, they're then rehydrated by putting some water into it and then injected back into the person. Multiple organizations have looked at this. There are no live cells in these products. There are, however, growth factors, and they can give some benefit. I personally utilize them in combination with some of our other stem cell and platelet treatments, but I don't use them on their own. IV stem cells, there's no proven benefit for orthopedic conditions. Understand that these are also not legal in the United States. And really, I'm specifically talking about utilizing your own cells for musculoskeletal and orthopedic conditions. This is certainly not a discussion about things like treating hearts and lungs and kidneys. So stem cell treatment outcomes. What's interesting is that even if you have advanced arthritis, you can get significant pain relief and functional improvement with these treatments. And that's because you can improve stability, you can improve inflammation, you can optimize what's going on in that joint where it's so unhealthy. And when you improve people's pain and function, you're able to get them to a higher level of physical activity, and that additional strength training then ends up giving them more long-lasting relief. On the other hand, can we improve imaging? In advanced arthritis, the answer is no. Things that we can improve: if you have a smaller tear in a tendon, ligament tears, I'll show some pictures of that. If you have swelling in an arthritic joint, if you have bone swelling in an arthritic joint, and if you have a condition called avascular necrosis where the bone is starting to die as well. I'll show you some examples of that. So a question was asked, can we treat bone arthritis? The answer is yes. Arthritis is a biologic condition. It's treatable with these treatments. In particular, if your range of motion and function are still relatively good, good outcomes are still possible. Some caveats to that would include more advanced hip arthritis is a more challenging condition. We know that in hip arthritis, one of the challenges is that the stem cells within the bone in hip arthritis patients do not function very well. And so one thing that I know between me and my colleagues that we talk a lot about is, can we treat hips at an earlier stage before they become too advanced? Can we treat the bone where the stem cells are starting to die and dysfunction? That may give a better result. But in general, that is the one caveat to kind of more challenging arthritis conditions. Expectations, I'm really a fan of giving very reasonable, proven expectations and hopefully doing better than that. Pain and functional improvement is very likely. Improving imaging is less likely. This is an example of, when people ask, can tendon and ligament tears be treated? This is an example of a patient of mine who had an ACL tear. Partial thickness tears, definitely. Full thickness tears, some. Depends on how badly torn it is. It's an example of a younger man who tore his ACL. He actually had a full thickness tear while playing volleyball. We ended up treating him with his own bone marrow-derived stem cells, and within 3 months, he really had great pain relief and functional improvement. But more importantly, I'll show you some images that show the actual healing. This picture here, this is the knee. It's the kneecap. This is the needle. And the structure that is lit up here, that is his ACL. To inject that takes a little bit of skill, a little bit of experience to do that. But being able to inject someone's ACL and avoid surgery is amazing. The fact that he was able to get back to a high level of physical activity in 3 months rather than a 12-month expectation after a surgical repair is really game-breaking. So this is an example of his MRI. Pre-treatment, his MRI, if you can see this, his ACL is extremely disorganized. This is either a full thickness tear or a very high complex partial thickness tear. Within 3 months of his treatment, this is what his MRI looks now. This is a pristine looking ACL now. There's a little bit of swelling just from that initial injury, but really pretty darn good looking MRI. This would be considered a normal looking ACL with a little bit of fluid around it. This would be considered a full thickness tear. And that is what these treatments can do in the right kind of candidates. This is a 57-year-old man. He's a contractor. He had a full thickness tear of his rotator cuff tendon. Treated him with his own stem cells. This is the hole that you see in the tendon on the left. On the right, this is filled in. This is basically 3 months after his treatment, and that's really looking great. This does not happen in everyone. Most people will get a good amount of pain relief. This is a good result where you start to actually see an actual filling in of that tendon tear. So in this regard, the way that you're dealing with a legitimate individual in regenerative medicine is, number one, what they're offering is legally compliant with FDA guidelines. They know how to utilize all the different treatments that are available in this space in a safe and honest manner. They'll give you realistic and honest expectations. They can appropriately determine your candidacy of treatment and give you realistic expected outcomes. Not so legitimate would be someone who is referring to amniotic and umbilical cord products, stem cell treatments when there's no live cells. That's not accurate. They're not using proven protocols and they don't have proven results. Those are some flags for sure. Before I get on to the next one, let me just look at some of these questions because I can see there's a whole bunch of questions that have come through. Okay, somebody had asked about some very specific things about their shoulder and their hamstrings. I just shown a couple pictures and cases of folks who'd had soft tissue injuries. For someone who has some chronic rotator cuff and AC joint arthritic issues and thickening of the bursa, again, that's stuff that we're seeing every single day. An injury to the hamstring, assuming that the tear is still amenable to treatment, is again something that we pretty routinely treating. All right, here's someone asking about basal arthritis. I assume you mean arthritis at the base of the thumb. Again, very common issue that we see in the world that we live in. So many people texting, typing, seeing that kind of arthritis is very common, and we're really commonly treating that as well. I'll frequently end up utilizing platelets to treat not only the joint, but also a lot of times the nerve. A lot of these folks also have a bit of carpal tunnel, and they generally do pretty well. Somebody asked about they have Sjogren's disease, they've got erosive osteoarthritis, they've had to have multiple injections and surgeries. That's obviously very difficult. In my experience, in folks that have erosive osteoarthritis, platelets do not do as well, but bone marrow stem cells can still get a good result when it comes to pain relief. That's an area, erosive osteoarthritis, that's a more aggressive version of wear and tear arthritis. And there's a big gap in medicine right now for folks who have that, because a lot of the traditional treatments that people have utilized, whether it's meds, other kinds of therapy, bracing, don't really work that well. Steroid injections don't work that well. I think this is an area where regenerative medicine, but in particular bone marrow stem cells can offer some benefit, but that's definitely a more challenging case. Yeah, and it's a great follow-up question regarding the ankle issue that I talked about before, that a lot of times ankles are misdiagnosed after an injury. I totally agree with you. I think if you have pain, functional limitations, or fatigue with activity, I think you should absolutely get that checked out. Especially for ankles, you can really find some very subtle soft tissue injuries and actually get those better with regenerative medicine, even just prolotherapy or platelets, utilizing your own cells. And you can make that diagnosis very easily with musculoskeletal ultrasound. All right. Another question asking if I work with Regenix. I work with Regenix. I'm separate from Regenix, but I've been in the Regenix network since 2012. Next question: does the bone get weak over years from wear and tear? That's a very fascinating question. A lot of times we think of arthritis as just a cartilage issue. In reality, what you find is that the bone might drive more pain than anything else. And so what we've come to understand about hip arthritis is that the stem cells within the hip, there's actually a couple of studies that have looked at this, that the stem cells within the hip bone start to become less functional and they become dysfunctional. And that might be what actually predicts folks who have more aggressive hip arthritis. So there is a growing trend for those of us that specialize in this to actually inject into the hip bone as well as into the hip joint in order to get a more profound effect. Okay, great question about insurance coverage. I will get to that a bit later because definitely need to cover that. Question before I move on about are these treatments safe during the current pandemic? Wonderful question. And the reality is, if you're doing this correctly, yes, they can still be safe. You need to properly screen patients before they come in. You need to keep the office appropriately safe. I know for my own office, we are still trying to keep most of our clinical visits over telehealth and really basically having patients come in if they need some diagnostics or procedures, but really trying to protect patients in that kind of way. So I think there's a lot of little things that you have to do this safely. But absolutely, if you do that, you can still get treated at this time in a safe and compliant manner. All right, I'll get back to some of the other questions as we move along. Interventional orthopedics, that is a very complicated way of saying using image guidance to treat orthopedic injuries. And I'll show some examples of that. By the way, thank you for the questions, always helpful. These are a couple of pictures. On the left, this is an ultrasound. The tissue along that I'm trying to highlight here is the rotator cuff, and this is a needle coming into the rotator cuff. This is a magnified picture of the rotator cuff. When you see this on the screen in the procedure room, this looks like a big, massive structure. The reality is when you're injecting into the rotator cuff, we're trying to inject into a sub-millimeter level. You can't do that without this kind of image guidance. On the right is a picture of an X-ray of the shoulder as I'm injecting into the shoulder joint and into the labrum. So what you see is this space right here is the shoulder joint. And the first line that you see that's going around the shoulder joint, that's injecting contrast and then cells into the cartilage of the shoulder joint. And this one up here, this little triangular structure, that's injecting into the labrum. And being able to hit these kind of fine, small little structures really only happens if you've got that kind of high level image guidance, which is really a requirement, in my opinion, to treat patients with regenerative medicine treatments. Again, these were pictures I showed before, but this is injecting into a patellar tendon, and then this is injecting into an ACL. Some of these things, including into the ACL, you absolutely cannot do that blindly. Absolutely not. It's just way too far deep and small within the knee joint. This is even hard to do under arthroscopy because if you use water, you can see the ACL, but the problem is when you inject your own cells, it'll wash out the actual cells. And so this is really a procedure that ideally should be done under image guidance only. It's another case study of avascular necrosis. Avascular necrosis is where the bone basically starts to die. This is a man who's got avascular necrosis in the ankle joint. He's got a little bit of fluid as well and some osteoarthritis. He's a relatively young man, 41 years old, injected into the bone and into the joint. And 3 months later, that avascular necrosis has resolved, the fluid in the joint is resolved, and most importantly, this is a man who's a chef and basically stands on his feet for 8 to 12 hours per day. He's back working with great pain relief and functional improvement. So a regenerative medicine specialist, the real deal is they're using high-level image guidance for all their injections. I sometimes laugh when I hear some of my more experienced senior colleagues say that they're able to find these targets blindly, just using their hands and surface anatomy. My response is generally, until I have X-ray vision, I am going to be counting on the tools that I have at my disposal, including high-level ultrasound and X-ray guidance. Understand that if you're really pushing hard as a physician, you're constantly trying to improve your skills, whether it's clinical, mental skills, or your technical skills, you're constantly trying to improve. And what I'm doing now compared to what we were doing 12 years ago, even 1 year ago, is continuing to improve. And then lastly, tracking your results in a formal registry. For my own results, we track in the Interventional Orthopedics Foundation, and physicians need to be doing this if they want to know how well are people doing with these kind of treatments. And if they're not, then frankly, they're not doing it the right way. Blind injections are not the right way, and not tracking your results is not the right way either. That's not how medicine grows and improves. Regenerative medicine treatments offer safe and effective solutions for your pain. That's really the big, I think, takeaway message I want folks to have here. Let me take a look at a couple more questions here. Someone asked about trigger fingers. That's great. I've had a couple of really great home runs with trigger fingers. Part of it depends on why someone has trigger fingers. Is it because they've had some chronic tendinopathy, or is it because they have inflammation? If it's inflammation, you want to make sure you figure out why that is first. But if it's more chronic wear and tear of the tendon, absolutely, that's something that can get much better. Yeah, so it's a great comment regarding, someone said in a comment about their ankle and how things have gotten complicated after surgery. Certain structures have collapsed and become unstable. There have been some hardware issues where a screw had to be taken out. The reality is there'll always be a need for surgery for certain conditions, either something that is just too severe or if you've got a fracture. But more and more of this is going to become less and less invasive with needle-guided skills. That's the way medicine goes, and that's certainly how this is going to be going as well. Is this too good to be true, all these things that I've said? Well, the evidence really goes back much further than people realize. We have evidence from Philip Hernigue from France since the 1990s. The Regenetics Network has data since 2005. This is a rapidly developing field, but it's not new. There is quite a bit of evidence, in particular in the last 10 years, showing good quality level evidence that this works. My personal experience goes back to 2008. And, frankly, things are growing fast, but this is not a new field. The principles that are involved have been in existence for quite a long time. Unfortunately, it's not formally taught to a lot of physicians who work in musculoskeletal medicine, but there are right ways to do this and there are wrong ways. And the right ways are some of the ones that I've mentioned. Expectations from treatment. I'm always a big fan of let's keep our expectations conservative and realistic, based on evidence-based medicine, based on averages, and let's try to do better than that. How long do results last? So Regenetics has data that goes out to 10 plus years now. Philip Hernigue in France has data, and he's an orthopedic surgeon. He's combined and in some cases compared his bone marrow stem cell treatment patients to his actual surgical patients. And he has data that goes 20 plus years. I mean, it's amazing. I still recommend to people, you can get very good long-term results, but if you have a chronic condition, expect you may need a repeat treatment at some point, whether that's a repeat full stem cell treatment, or if that's even just a platelet booster, expect you may need that a couple of years later. I think the best way to maintain results after treatment are improve your biomechanics, posture, strengthening, take the appropriate joint healthy supplements that we know are helpful, and repeat treatment is also additive, meaning if you've gotten a certain level of improvement, but you're not quite at your goal, a second treatment can sometimes get you closer to that goal, because we know that these treatments tend to be durable and longer lasting, and they tend to kind of build off of each other in a stair-step manner. Cost. So this is always a topic that comes up rightly. Health insurance and cost is a ridiculously complicated issue in the United States. And the reality is that regenerative medicine is not routinely covered by insurance. What's interesting is that there is a military insurance that has started to cover these treatments for military veterans. Other parts of the government, when it comes to their insurance, including Medicare, do not routinely cover this. They don't cover it. There are some self-insured companies that are now adding this to their benefits plan. What that means is companies that are essentially taking on all the risk for themselves are now adding this to their benefits plan, Regenix procedure specifically, namely because they feel like they can keep people healthy and reduce their healthcare expenses. If you work for a company that is self-insured and you may be interested in learning more about this, go to regenixcorporate.com and they can certainly give you those details. Cost estimates. These are kind of averages that you'll see around the country. For platelet-rich plasma, generally starting at $1,500 per treatment, and stem cells starting at $6,500 per treatment. How do you determine whether this is a good value? Here are the way that I would recommend this. Number one, are the physician and clinic regenerative medicine experts? If they're not, you're not getting good value. Number two, are you receiving a real stem cell treatment, or are you receiving something like a dead cell treatment like amniotic or umbilical cords? If something is being mislabeled, you're not getting the right value. And then lastly, understand that these really are in-office procedures. You don't need to be going through hospitals or surgery centers where you rack up big facility fees. These are things that can be done without having to go through that kind of process. All right. So in the beginning, I talked about, what is our approach to treatment, and I hope some of what we've discussed so far is highlighting some of the ways that you can figure out, who is a good option for your care if you're looking for non-surgical treatments for your osteoarthritis, tendinitis, injuries, and back pain. We're focused on non-surgical treatments, avoiding surgery, and evaluation that looks at all the drivers of pain, including inflammation, instability, asymmetry, and neuromuscular issues, starting with lower level treatments, correcting things like posture, strengthening, exercise supplements, and if not working, then escalating to the regenerative medicine treatments, utilizing the highest quality products from your own body, utilizing a plan that's tailored for your own specific condition, and delivering your cells using the highest level of image guidance. Some of the things that we stand for that I think we should talk about in a world where I think, if you're someone who lives in a principled way, I think we're in a world right now where you should kind of declare those. Unfortunately, not only in the world, but certainly in healthcare, I think we need a little bit more of this, but integrity is a big one. I think if you're someone who believes in integrity, then you should state that. Respectful and collaborative care. These treatments are still relatively new and they're outside the mainstream. And I think it's important for patients to really understand what this is about. Transparency regarding candidacy for treatment is essential. You need to know, are you a good candidate or are you a poor candidate? Transparency regarding cost. A lot of healthcare, unfortunately, in this country is not transparent. You need to know what's involved in that. And then offering the best options that are available as opposed to what's convenient. The reality is that a lot of what's done in healthcare in this country is frequently not what's right for the patient. When you ask yourself as a physician, what would I do if this was my own mother or father or family member? It's not always what healthcare does, unfortunately. A lot of healthcare is built upon a one-size-fits-all model. What works in that machine? And that's not always what's best for your own personal healthcare. And the reality is that, if you come at this from a surgical perspective, you may not necessarily see the value in non-surgical options. That's unfortunate because The most forward-thinking surgeons that I know will look at non-surgical options, including regenerative medicine options, as adjunctive and potentially aiding in their patient's care. And unfortunately, there are surgeons who also look at this and close their eyes as to what's new. And that's a problem, because medicine is such that treatments become less and less invasive, more and more focused, and less risky over time. And if you look at this from a strictly surgical lens, you'll end up missing, where this trend is going to. So lastly, how do you get evaluated? I appreciate everyone's time and listening in. It's fairly easy to get evaluated. What you should have popping up on your screen, I hope, is a relatively easy way where if you click on what's popped up, it'll take you to an electronic form that'll allow you to book an appointment to make an evaluation. We're here to assist in any way possible. And I mentioned that if you stuck around long enough, you'd be able to get a discount on something that we have in the office. I'm a big fan of utilizing over-the-counter joint healthy supplements, in large part because, number one, they're low risk. Number two, there's actually pretty good data on some of these. The Regenerative Stem Cell Supplement is a supplement that has 8 different supplements that are healthy for the joint. It normally goes for roughly $100 per month. If you email us with the discount code webinar, you'll be able to get 25% off on that as a sign of appreciation for sticking it out and learning more about your health and musculoskeletal wellness. Other questions before we wrap it up today? I see a question from someone asking about platelet lysate treatment for their neck. And could that be helpful? And how long does it take after treatment to notice improvement? What's really great about treating something like the spine is that if you hit all the targets that are driving pain, and in something like cervical spine stenosis, that would include injecting the ligaments that have been damaged. It would include injecting the facet joints and even the epidural space. You'll get pain relief. And in general, what I tell patients is you'll have more inflammation for the first couple of days after treatment. You'll have some stiffness in the area that was treated for the first 1 to 2 weeks. And generally, people are noticing an improvement at the 4 to 6 week mark. I like to reassess people at the 2-month mark to see where they are. And if they tell me that they're noticing improvement, then I would say continue to follow it out. As they go on, because we know platelet-rich plasma or platelet lysate will generally give progressive improvement out to the 4 to 6 month mark. And if at some point they start to notice a plateauing of their response, then deciding whether or not a repeat treatment would be appropriate. If they've reached their goal of treatment, then great, then just continue exercises as tolerated. But if they're basically stuck and not being able to progress to that higher level, then repeating treatment would make sense at that point. Other questions before we wrap it up? Great. Well, thank you everyone for your time tonight. And hope everyone's doing well. If you'd like to get a replay of this, you'll be able to do so after we're done. And if I can help out in any way, please let us know. And until we connect again in the future, have a good day and live well. Bye-bye.